Welcome to the demonstration video on how to access results in the TB module of the Integrated Health Tool, or IHT. This builds on previous videos that covered configuration of a projection file, adapting demographic and HIV projections, estimating populations needing TB services, and identifying the costs associated with TB service delivery, shared health system costs, and program support costs. Results are found in the final section at the top of the screen. You will see that they are organized around numbers of people served, resource requirements, and cost. If you have used the statistical or dynamical impact model, you will also find impact results. This video will demonstrate some of the results available, as well as how to configure and export them. The first set of results shows the number of people served by each intervention. This is followed by the number of people served by health and age profile, which includes a more detailed look at the care cascade for each population group in the target population estimation process. For each result that is generated, you have various configuration options which can be accessed using the configuration wheel icon. These include time frame, where you can specify a subset of years within the projection time frame to show. Format in which the result is shown. Most results will provide a table as the default format, but in many cases you can also convert to show percentages instead of absolute numbers. Delivery channel can be configured to show results just for one delivery channel. In the case of intervention-associated results, you also have the options to show results by the delivery channels for greater disaggregation, or to aggregate the results by intervention groups such as screening, diagnosis, prevention, and treatment. For cost results, you can show the result either in US dollars or in local currency. You can add inflation to show anticipated increases in costs over time, or leave inflation off to present nominal costs. Numbers served by age and health profile results include outputs for each population of interest that represent the cascade of care from screening, diagnosis, treatment and preventive treatment, broken down by age. It also includes results on the number of people tested for resistance and found to have drug-susceptible or resistant TB. Preventive treatment results summarize numbers of people with presumed or confirmed TB infection, broken down by age and by drug resistance. The target populations summary provides a downloadable file including the full array of target population results. The next section of results captures the number of different resources used to deliver health services. Based on the information entered in previous steps, the tool generates units of consumables required, number of outpatient visits and inpatient days, personnel time by cadre, and number of facilities to be equipped. Tables can easily be copied to Excel for additional manipulation by right-clicking in the table, selecting the option to copy all, and pasting in Excel. Configuration options are available for each of these results through the gear wheel. For example, the personnel time result can be viewed by number of minutes per type of staff, which is the default selection, or by full-time equivalence. Please note that the tool includes default values for the number of minutes by personnel type, but if you have chosen not to include personnel costs in the analysis, you can ignore this section. Personnel costs require salaries to be entered in the configuration section in order for these costs to be included in the cost section of the results. Cost results are found in the following set of tables, including consumables costs and program-specific health system costs. Program-specific health system costs are desegregated by components such as outpatient visit and inpatient day costs, as well as TB-specific infrastructure and equipment costs. Program support costs are found in the next set of results. They will only show if these costs have been entered in the costing section. Program support cost results will generate by default at the section level, but you can configure this to show more granular results at the subsection, activity, cost category, and input level. You must select the option for additional detail to be able to activate subsequent more detailed selections. For example, once I activate the option to show results by subsection, I can now add results by activity, which is the next layer of detail down. Summary results include an overall cost summary, as well as summary of service delivery intervention costs, which include consumables plus the inpatient day and outpatient visit costs, or the personnel costs, with the costs organized by intervention. You can choose which of these cost categories you wish to show. You can also access a summary dashboard, which shows information on total cost, cost drivers, and numbers of people on treatment. Results also include the average cost of consumables per person served by each intervention. Cost results also include budget and funder mapping, which are discussed in another video. Impact results called baseline burden and projections show the incidence and mortality estimates generated by the impact model selected, including the lower bound, midpoint, and upper bound. You can see these in a table or convert to a graph. Impact results show the comparison of the current projection file in which you are working compared to a counterfactual file. For mortality and incidence, the difference between the two represents the number of deaths or new cases averted by the plan being considered. The scale-up scenario represents the midpoint of the modeled projections seen in the previous section. Much like modeled projections, you can show these results either as a table or as a graph. If you wish to download the graph as an image, select the download option at the top left of the image. Cost and impact results bring together the total budget and the cases and deaths averted by the plan into a downloadable dashboard. Thank you for viewing this demonstration video. Additional results outputs and functionalities will continue to be added or modified based on users' feedback. If you have any questions, please reach out using the Contact Us button.